I'm worried about the hospitals in the United States. I'm Dr. Bizaccia. I am a family physician. I have a direct primary care practice, which means I don't take insurance. So I spend a lot of time thinking about what the United States healthcare system would look like if we could get rid of insurance altogether and how much money would be saved. However, the reality is that right now, about 40% of hospitals in the United States are operating in the red. Over the past 25 years or so, we've seen a 33% decrease in reimbursement with taking inflation into consideration. What this means is that hospitals are a losing business. And if all these people are going to lose their subsidies and not be able to afford their premiums, and they're going to get rid of their insurance because they can't afford it, those people still need to use the hospital. I mean, unfortunately, things happen. And then they will not be able to pay, and the hospitals will be the ones to eat that. And we'll see hospitals close. We're definitely going to see hospitals closing. I mean, it's already happening, but I think we're going to see it accelerated, which is very concerning to me. And I mean, during my career over the past 20 years, I've seen the way hospitals function change dramatically. When I was first starting, we would get patients come in the emergency room, they've got something weird going on, they've been losing weight, there's sweats, all kinds of things. We admit them, we figure out what is going on, because in a hospital, you have all the specialists and you have all the machines. That's what the hospital is, and the beds and nurses. And so people come in, we keep them, we bring all the specialists that we need, we use the machines, we used to figure out what was going on, and then discharge them with a plan and with the appropriate follow-up. Over those 20 years, I saw very quickly things change. As soon as people came into the hospital, we were already trying to figure out how to get them back out. It was like basically the hospitals have turned into like massive ERs, where the idea is get them out as fast as possible. And that is because hospitals lose money on admissions. Like the longer the patient is in the hospital, the more money the hospital is losing. And so we're now pushing people out of the hospital. I'm out in the community. I don't work in a hospital anymore, but I'm on the receiving end of patients who really aren't stable enough, need the machines, need the specialists, and now we have to try and make that happen in the outpatient realm, which is really, really difficult to get appointments, get the CAT scans covered, get all of that done. But it's like a game of hot potato, and the patients are the ones that suffer. Something has to change. Everything is very broken. And I'm sorry, I don't know what to do about it. I just think it's important that we all are aware of it and that we're talking about it. If you find this interesting, follow along, and feel free to share with anyone you think would find it interesting. Thanks. Bye.